bilateral assisted devices. Okay, crutches. We don't have forearm crutches or anything, but so basically your crutches. If it's I told you a 2 and a 4, right? So if it's a modified 2 or a 4, you use 1. Okay, but you can use a crutch or a cane. Okay, we'll go through some scenarios in a minute. So then if you're using a 3-point and you're either non-weight bearing or partial weight bearing, you need to use what? 2 crutches or a standard walker. Okay, but it has to be, something with 2 hands. Okay, so make sure you know all your options. Okay, so if we have a partial weight bearing, we could have a scenario that maybe told us they can put 50% of their body weight on it. That's considered partial. If they are a toe touch weight bearing, what does that mean? They're less than 5% of their body weight. Okay. Should we encourage them to truly walk with only their toes touching? No. Why? It's not a typical gait, right? So we still want to encourage them to put their foot flat, but they should be putting less than 5%. So how can you know if they're doing that? You should see them pushing through their arms. Remember? Okay, if I just see this, I can tell they're putting more than, 5%. So I can have it here, and I can push through their arms, and I see they're basically have it down there for balance, but no more weight than that. Okay, but the foot can be flat. We don't want to really just toe touch. Okay. So we can do a modified 3-point with a walker, and then we can do the modified 3-point with our bilateral crutches. Okay. So we can still do this. Okay. So does that make sense to everybody? Okay, that review. Okay, so let's do some scenarios and see if we can come up with the best gait pattern to use. Okay, so we have our 15-year-old with spina bifida that has moderate weakness in their bilateral lower extremities. Okay, maybe they wear long leg braces to give them some support. And they were using a K-walker. They would like increased functional mobility, so maybe they could do stairs. What assistive device might you consider for them?
Bilateral crutches.
Right, bilateral crutches. Ideally, we could use forearm crutches, but I don't think we have forearm crutches here. So, so we would use axillary crutches. And what gait pattern would we start them off with? A 4-point gait pattern. Okay, because we're just going to be starting to teach them that kind of gait pattern. So, 4-point gait pattern with bilateral crutches, and then you would demonstrate for them, and then you would walk that patient. Okay? Good. So they have weakness, but they have full weight bearing status. Okay? Good. Let's see. We have a 68-year-old with a total hip replacement, non-weight bearing left knee. 3-point gait pattern with what kind of assistive device? A walker. Right. Why would you choose the walker over the crutches for this patient?
She's 68 years old.
Because they're older. They probably don't have as much upper body strength and coordination. Okay, so we know that's probably going to be a safer bet. So good. Okay. Our 54-year-old male who had a stroke that affected the right side 5 years ago. Okay. He has mild right lower extremity weakness.
A modified.
I would think probably more a modified, okay? You could start him off as a modified 4-point and then progress him to a modified 2-point. What kind of assistive device might you use?
A single crutch.
I would probably start with a cane. And you might, if it was the first time using a cane, you could give him a wide-based quad cane. Okay? Which side would he use the cane on if his right side was affected?
His left.
His left side. Where would you stand when you're walking with him? On his right. Okay, so if we did the modified 4 with the quad cane, we would go 1, 2, and 3. Okay, the cane, the bad foot, and the left foot. If we progressed him, we could give him a modified 2, which would go here, right? Okay. Does that make sense? Okay. Our 18-year-old with the fractured left ankle, who's a non-weight bearing left side, would be a 3-point gait using bilateral axillary crutches. Good. Okay. Let's go a step further. Our same 18-year-old who was non-weight bearing for 6 weeks, he's now been cleared to start weight bearing as tolerated. Okay? Well, he was a non-weight bearing here. Now he's cleared for weight bearing as tolerated. You could do you could do